I now invite Dr. Sandeep Saxena, sir, for his talk on sequential restoration of external limiting membrane and ellipsoid zone after successful macular hole surgery, the pathoanatomical aspects. Sir is a senior professor and chief of retina services at the Department of Ophthalmology, King George Medical University, Lucknow.
Hello, good afternoon. I had the privilege of writing the first chapter on macular surgery and the first surgical review on macular hole during my fellowship days more than 25 years back. And since then, macular surgery has come up a long way as discussed today. I'm thankful to Dr. Bhende and Dr. Ratra for having me here. And today I'll be discussing some of the pathoanatomical aspects for successful macular hole closure. In a recent editorial of 2023, we had highlighted the impact of race and ethnicity in the closure of the macular hole and the possibilities of developing algorithms through artificial intelligence to monitor macular holes and its closure. So as we all know that several classification systems have been given for the types of macular hole closure, but I think the type 1 and type 2 types of closures stand well. Now after a successful macular hole surgery, as the traction is relieved, the things start to come back, and an analogy can be drawn on an SDOCT cross section, and this analogy can be drawn with the closing of the Tower Bridge of London as the hole starts to close. Now, we recently reported the sequential restoration of ELM and EZ post-macular macular hole surgery. The noteworthy thing here can be that the EZ defect may be more than the size of the linear diameter of the hole. And here is just a case to present a stage 2 macular hole, and as the EZ and ELM restores over a period of time, that's 1 week. Now then at 4 weeks, subsequently at 6 weeks, things are becoming more or less normal. And then at 12 weeks, and finally at 6 months, the macular architecture is well maintained. Now about 12 years back, we discovered ELM as a structural retinal barrier in cases of DME, and we showed that ELM was a prerequisite for the restoration of EZ, and recently we showed that the sequential restoration of the ELM preceded the restoration of EZ after anti-VEGF therapy in DME, and the same cue can be drawn onto the macular holes also. So I think for the residents, ELM can be defined as the junctional complex between the glial Muller cells and the photoreceptors, and it serves as a very important barrier against the macromolecules, and this barrier effect of the ELM is due to an occludin protein, that is a 65 kilodalton protein. And subsequently in the year 2017, Howley reported that the preoperative length of the ELM defect was a very important predictor for the visual acuity. The EZ, as we know, clinically defines the photoreceptor integrity, and the visual outcome after macular hole closure basically depends on the restoration of the EZ. Last year it was shown that the reduction in the defect of the ELM and EZ continues over a period of 12 months. So after the hole has closed, maybe the ELM and EZ may get on restoring for a period of about 1 month. for about a period of 1 year, and this has also been shown through a series of publications recently. Now, the adaptive optics, as discussed earlier, has also been a very important part in the photoreceptor recovery, and it has been shown that the parafoveal cells migrate in the restoration, and the cells nearest to the margin, that is at about 2 degrees eccentricity, shows the maximum effect. Now, about 20 years back, it was shown in the adult mammalian retina study that the adult mammalian retina has the potential for regeneration, and it was shown that the glial Muller cells proliferate and produce new neurons. The intrinsic and extrinsic factors or environment basically promotes and partially controls the differentiation of these cells into the retinal neurons. So, Muller glial cells have a very important role in the regeneration or restoration. So, a Japanese group has shown that how the hole basically closes. The macular hole closure gets into the initiation of the initial glial proliferation. The ELM bridging starts, the glial elimination is happening subsequently, and then this leads to a complete ellipsoid zone regeneration, and subsequently a complete photoreceptor restoration happens over a period of time. More recently, as Dr. Vinod had also highlighted, SPAIDE has shown that the healing mechanism for the macular hole suggests a process of foveation where the retinal inner layers go out and the outer layers come in, and this can be recapitulated into the first decade of development of the macula. So all these factors have to be taken into consideration also when we are assessing the macular hole closure and its follow-up. So we came up with an ELM EZ restoration-based grading system for a successful macular hole surgery. This novel grading system is physician-friendly and correlates with the visual outcome. In grade 0, there is a persistence of the ELM and EZ defect. In grade 1, there is a partial or total restoration of the ELM with a shortening of the ellipsoid zone defect. And in grade 2, there is a complete restoration of the ELM and EZ with good visual outcome. So we also did a biomarker study, and we found that the EZ serves as a very nice structural biomarker for post-operative visual improvement. So the take-home message from my talk would be that the ELM is a very important retinal structural barrier. The Muller glial cells proliferate to produce new neurons. There is a sequential restoration of the ELM, which is followed by the EZ, and our novel grading system provides a physician-friendly approach. It incorporates the pathoanatomic mechanisms of repair and provides visual prognostication for a successful macular hole. I'd like to dedicate my lecture to one of my gurus, Professor Landers, who was a retinal legend of his time. Thank you very much.
Thank you, Dr. Saxena, sir, for your enlightened talk.